So how much iodine is enough, basically, to consume? This is another area of great controversy. There's so many opinions about this. And by the way, when I reference iodine, I'm basically referring to either iodine or iodide, because the body uses both. There are opinions ranging that the daily intake should be anywhere from 100 micrograms to 50 or more milligrams. This means that the low end of the dosage recommendation versus the high end, the high end is 500 times more than what the low end recommendation is. So this is such a huge range. So this is one of the challenging things to discern. These dosages are made up anyways by people who have opinions. But looking back through history, at the second half of the 1800s and the first half of the 1900s, iodine was used so commonly, and people understood the powerful effects of it. And a dose was typically around 15 to 100 milligrams, somewhere in that range. There was some mega dosing that would happen for certain acute instances where someone would actually be taking 1,000 or 2,000 milligrams, but generally it was more like 15 to 100. Now, by the 1950s, a phobia of iodine developed in the mainstream community. Now, this is due to claims that basically there was two men by the name of Wolff and Chaikoff, and these were industry men, and they made some assumptions, which were unsubstantiated, regarding T4 release in rats that were being studied, in basically the thyroids of rats. And they basically drew some conclusions that were not logical. I'll explain my personal view on that, but this resulted in a 50-year kind of chilling phase, a freeze, where basically professionals became nervous to recommend iodine. People would recommend not taking any more than, let's say, 100 to 300 micrograms, which is a tiny amount. So therapeutic use of higher doses went out of fashion, although it was still recognized that a lack of iodine can cause major health problems, and so the governments still continued to iodize salt. And we're just going back through the history of understanding this. Now, what happened was in the late 1990s, there was a scientific investigation that was undertaken by some people, including Dr. Guy Abraham, Dr. Jorge Fleches, Dr. David Brownstein, and this was referred to the Iodine Project. And basically, these people conducted laboratory research and clinical research. In other words, they worked with thousands of patients to document more accurately the effects of iodine. And what they found was that when an adequate amount of iodine is consumed over time, the body will retain about 1,500 to 2,000 milligrams of iodine in its tissues and excrete out any excess consumed via the kidneys and urinary tract.